That would be the podium mic would be.
Yes, it's right here.
Okay. Good morning, everyone. I'm Mary Margaret Oliver, Chairman of the Subcommittee for Workforce Development Systems Development. And I'm very happy have you all with us today. We are starting a little bit late, always a few little logistical issues to deal with. Thank you very much for tuning in. I want to introduce our committee members who are here. I'm Mary Margaret Oliver, Chair, and a member of the Behavioral Health Commission.
Good morning. I'm Cindy Levi, CEO of Avita Community Partners and representing the Georgia Association of Community Service Boards.
Thank you.
23, sorry.
Good morning, Nicoletta Servan, Professor at Industrial System Engineering at Georgia Tech.
Online with us this morning is who? Please identify yourself. I know there's somebody there and maybe we're dealing with some mic issues, but thank you all for attending today. We are working on our subcommittee report that will be submitted to the Behavioral Health Commission. Y'all probably know that the full commission is meeting on December 6th, 10 a.m. And we are pulling together a report for all of the subcommittee's activity during this summer. Just as an update for you, in addition to looking forward to December 6th date, I want you to know that even though House Bill 520 did not pass the Senate, Commissioner Tanner has been busy on many different ways, many different items that were specifically in 520. He has been able to move forward and accomplish. We will, on our agenda this morning, we will hear from item 1 on the 520, which was a staffing report, which Commissioner moved forward, and we will have a good discussion about that, about the recommendations we need to make for workforce development across the state for behavioral health and mental health services. He also, Commissioner, has gone ahead and found resources to fund the bed study, which is a significant analysis that we will be looking at closely about moving forward. He has in many ways been working with OPB and the new leadership with OPB in relation to monies that we appropriated and how he is filling the holes that may have been created by some of the disregard or veto. And I think that his efforts on that are substantially successful. And I'm very pleased to hear good news occasionally about how the funding proposals that we made are coming to fruition or have some real hope for being real in our budget and across our state. So there's a lot of work going on, and I look forward to having a full committee meeting to make our report of our subcommittee on December 6th and to work with all of you on how we can move forward with the original goals and those year 2 goals for the Behavioral Health Commission and bring forward a good package of recommendations to the General Assembly when we begin our work again on January 8th, 2024. First on our agenda this morning, the Deloitte Workforce Study. Principals with us, and would you please come to the microphone here and please tell us your name and what your participation is in this report.
Sure. Thank you very much. Will Arnold, and I'm a managing director at Deloitte Consulting and a leader in our human capital practice where workforce sits. And we did a report that you have in front of yourselves, and it's on the screen for the commissioner and DBHDD around their workforce innovations and some recommendations for them to consider and take forward as they look to, long-term make their operations sustainable.
We're going to make this full report available to anybody who'd like to see it on the Behavioral Health Commission website. If anybody has any specific questions about it after they read it, they're very welcome to contact me directly at my email address at my law office, which is mmo@mmolaw.com. But please go ahead and tell us what your recommendations are.
Sure. Thank you. Thank you for having me here today as well. So this slide here, what we wanted to do when we first engaged with the commissioner and the department were to think about what are their goals and their missions. And so you'll see on this slide, looking at the right-hand side, the goals around kind of workforce diversification, enhanced employee experience, looking at workforce related items that are going to bring a high return of investment, knowing that, as we all know, dollars are not necessarily unlimited. And then ultimately making DBHDD a career destination. And so, it was important to understand what those goals, that vision were as you think about recommendations, because you want to make sure that those recommendations that we're looking at in innovations align with the department's visions and goals. And then on the left there, you'll see, which I'm sure many of you have heard, the commissioner's mission statement around providing care for Georgians and, making it sure that it's in that dynamic, that given the dynamic healthcare environment that you are all living in. What we did is essentially went through a 4-stage kind of approach. And so you'll see here, it started with looking at an assessment and a compensation study. So we analyzed over 105 job codes. We looked at your turnover, the department's turnover data. We conducted interviews. We held a number of focus group with actual employees. Then additionally, we did an environmental scan that went over 100 plus and a very really kind of wide mix of public and private entities, whether they be some health systems, nonprofit health systems. We looked at nonprofits, we looked at educational entities, and we looked at across not just within healthcare, but also other larger companies that think about workforce best practices. So, you think of the large, the Lowe's, the Home Depots, the Chick-fil-A's, the larger entities that have similar workforce structures, particularly as you get into the wide variety of job classifications that the department has, because it's not necessarily all just nursing, right? They have food service employees and janitorial staff, et cetera. So there's a wide range of workforce that's important to look at as you're, kind of and doing that environmental scan. Then what we did was we held a breakthrough lab, and we had a lab of there were 16 individuals from public and private sector leaders that we had come in, and we had some, preset recommendations that we had heard, and we asked them to really design a kind of go forward plan for the department. And we had representation from, some of the large health systems in Georgia. We had Rivian there, we had Chick-fil-A there, we had Dr. Brenda Fitzgerald there. So we had a number of both health as well as large industry representatives as part of that to really help work with the department to start to think about recommendations for what could a plan look like for the department to move forward as they, were to embark on this journey. And then lastly, we reviewed all of the environmental scan data. We reviewed the compensation data. We reviewed the outcomes from that breakthrough lab, and we created an action plan and an overall roadmap that is at the very back of this document in an appendix for DBHDD to consider and think about as they embark on the journey. So when we look at the numbers, and I won't overwhelm you with them on the slide, but when we talked about digging into the numbers and really, what is the current situation at the department? If you look at, I'll draw your attention to kind of two that really stand out as you think about it, right? Right now, their millennial turnover rate is at 57%. It's an enormous turnover rate within a department.
Define for us millennial. I always get those numbers not clear in my head. What is the millennial?
So that would
definition?
It's like it's the true definition of like a millennial. So it would be those that are in their like late 20s to like 30 to 40 years old. I believe is technically the age range that is. And then kind of even further, if you think about it right there, 29% of the workforce, so almost a third of the workforce, is eligible to retire within 5 years. So within 5 years, they could lose and have what we call brain drain of 30% of their employees that have been in the department, that know how the department operates, and really knows how to make the department be successful. And so they're now they're facing a turnover rate of 57% in some of their key growth areas for leaders, because that millennial population is where you're starting to really form your next group of leaders. And then you're now potentially going to lose within 5 years, 30% of your workforce is eligible for retirement. And then if you look at some of the things on the left there around recruitment, retention, and care delivery, those were direct feedback points that we received from interviews. Rural workforce recruiting is becoming a larger challenge, as we all know the growth that's happening in Athens and some of the north with some of the large manufacturing corporations and stuff that are moving in, that now puts a strain on those kind of hourly positions that the department requires and needs. The number of times, or the length it takes for recruitment, right, to get someone from initial interview into being a productive employee. There's a long-term challenge there that we heard from staff. As you think about retention, we heard a lot around professional development opportunities, compensation, and really kind of a disconnected from leadership, and not necessarily from Commissioner Tanner at that level, but more of their direct supervisor. When they were saying leadership, a disconnection between their direct supervisors in some cases. And then as it relates to care delivery, an over-reliance on paper, making sure that they're able to meet their continued education requirements, and then administrative burden. And then on the right-hand side of this table, everyone's favorite topic on compensation. If you just look at the numbers, they're pretty staggering, right? So, on average, across the entire board, DBHDD salaries are 19 below the median market in the nation. If you look at, something more particular around the psychiatrists, physicians, and some of the more skilled positions, they're 24% below. And then we did do some specific deep dives on the job codes, and this is just a summary. We have the full details in the appendix.
Let me
Yeah.
ask you about the
Sure.
total data in your appendix. Do you have a break? How many employees are there in DBHDD? And do you include all of the boards, the local boards, community service boards?
We only looked at 105 job codes that the commissioner had selected. So we didn't hit every single employee, but we hit the ones that they felt were the most impacted of their employee group. And we did not hit the CSBs. We focused on actual DBHDD employees.
And somewhere in your analysis, not including CSBs, you have vacancy rate data in your report, yes or no?
We have vacancy rate data. It's not necessarily in this report, but that was one of the data items we looked at overall, was vacancy rate data.
I'm just curious if that somewhere in your report, it says which of your job categories, codes, if that's the right word, do you have the most trouble? Is it clinical positions? Is it, what is the most troubled vacancy rate you have?
So the most troubling vacancy rate was in the nursing positions and some of the administrative positions to fill, and that ties back to empty beds that you have available that you cannot get filled, not only that are DBHDD, but also in the CSBs.
That's helpful to me. And if I wanted to really drill down on that, there's numbers in the appendix that'll give me more information.
From the vacancy rate, we have access to that data then I'm sure the commissioner could share with you, that they shared with us specifically on vacancies.
Okay, thank you.
So, now let's talk a little bit about the path forward, right? Because It's not all doom and gloom. There are pathways to success. And so we really broke down our recommendations into kind of 3 groups. And in the appendix, there are every single recommendation that we made. But I'll hit on just a couple here, and then we'll do a deep dive specifically on some of the short-term ones. So we looked at the short term really being in the next year. Here are the recommendations that we think that the department should consider carrying forward. We looked at the medium term, 1 to 2 years. What are the things that should be tackled? And then longer term, what are some recommendations to really drive some of that sustainability into the system? And so when you look at the short term, there is, and it came up several times around career marketing, and it's not necessarily around changing the brand or doing more advertisements on billboards. That's not really what we mean by career marketing. What we're really talking about with career marketing is starting to understand and get with junior colleges, technical colleges, high schools, and starting to form partnerships with them to get them educated on what is DBHDD, what does a career look like at DBHDD. And we, specifically talked with some of the health systems around doing things like that they do now around like camps and internships and stuff like that to get exposure to those populations about DBHDD in a career, and highlighting the positives and the impacts that DBHDD employees make every day, right? Highlight, do a quick vignette with a nurse on their day and their impact that they feel that they make. And it drives kind of 2 factors. One, it drives a factor with the employees themselves around their retention. Hey, we're doing really good work. It builds that camaraderie, and then also can be used for education to people to understand what it means to be a DBHDD employee. We had process optimization. So you heard on the slide before around a lot of paper processes, a lot of work that's being done that's inefficient, that's requiring extra work from nurses and individuals that are trying to do their jobs. So looking at optimizing those processes, what can be automated to save them time so they can spend time doing what's important, and that's working with people that are in care and that need care. Career pathway program. So then this was another item we heard around staff having the capability they felt to grow and have the ability to learn and to expand their careers. So, we heard of, Chick-fil-A had a great example of this in the lab around having like a work center where they meet every year and talk about what are your objectives for your career? What are the things you should be doing? So really working with the employees so that they see that there is a journey, not just I'm going to work here for a year or 2 years, but they have a journey and a growth journey that will help them meet their objectives, right? And potentially drive at that career destination goal and mission that the commissioner has. One that we were talking about briefly right before this meeting around out-of-state license reciprocity. It's a very common sense thing, but right now there's a struggle to get that taken care of, right? There's a struggle with people that have licenses in the department, in CSBs, and they can't get their license from Florida or another state recognized in Georgia. That length of time is a real hindrance and causes a real impact right now to the state. And then of course, salary market adjustments that we talked about, and from a compensation perspective, particularly in the nursing area, just given the gap between what DBHDD nurses are paid compared to the national average. When we look at the medium term, it's more things around, expanding telehealth, expanding partnerships with law enforcement and community groups. So thinking about ways that we can continue to engage with community organizations, nonprofits, law enforcement agencies to drive that engagement and that partnership for the better of care delivery, right? There was an anecdote that they're piloting right now around working with law enforcement and putting someone from the department in with that law enforcement to help de-escalate situations and make sure that that person, maybe shouldn't go to a jail or a holdup. They should actually be admitted to a hospital, and understanding how that partnership can work to drive successful situations. And then thinking about, is there a way to provide, education stipends or, to continue for that continuing education so that people see that they can grow, have ability to work and have a way to pay for it, as well as, some sort of, maybe daycare or something like that on property, so that if a nurse has to work an odd shift and they don't have childcare, that they've got that available to them, so that they're able to and it makes it an attractive position when I have that as a growth. And then we talked a little bit about kind of the internship program, and that's continuing that career marketing campaign. And then more long-term things like employee housing. So could you put, employee housing where you have some of these hospitals? So, especially where you have nursing and hospital staff that run odd hours. So they're working, odd hours. Is there a way for them to have a spot to sleep for the shift, so they don't have to drive maybe a half hour home or 45 minutes home each way? Thinking about, could you create and expand, additional sites to make it, more coverage, especially in some of the rural areas. And then just overall thinking about the kind of the ecosystem and expanding, kind of bringing in all the partners, the CSBs, the nonprofits, and really creating a workforce development ecosystem that would benefit everyone in a long-term way. And I hit on a lot of these short-term recommendations when I was describing the last ones, but happy to answer any questions. We pulled out the ones in the short term. There was 11 total, but these were really the 5 most impactful that we thought, and particularly thinking about that automation, the partnerships with universities, the partnerships with, high schools, doing, more advertising is the wrong word, but more proactive communication with, individuals that could build that pipeline for the future. But any specific questions, I'm happy to take on any of the short-term recommendations.
Were you able to identify any specific regulatory or statutory changes that were needed for the out-of-state license reciprocity?
There are, and that is a hurdle, and I believe it is during discussion. I believe it might be already under discussion for this next session.
Well, it is under discussion for the next session in several different rooms. And so I'm trying to figure out who's coordinating that or who's most on top of it. As you know, the Senate, and when they did not move forward on 520, said they were going to look at the licensure issue for all licensure issues, not just the mental health related. And Senator Larry Walker is chairing a committee on license issues. Secretary of State Raffensperger is chairing a commission that and I am in touch with those entities and trying to really figure out where the specificity is that is going to help all of us move forward. I'm happy for the Senate to come forward with specific recommendations, but the licensure issue comes to every member of the General Assembly, as far as I can tell. Some constituent is having a problem with some license. And so I think there's a will here to do something. And the military have done probably the most advanced work in making sure the license holders, as they move around country. So I'm really interested in any specificity y'all have on that.
Yeah, we didn't have any specific, we didn't research any specific aspects of where it should sit or who should control it. It was more just a general discussion around it. We understanding whether it is a problem, then it needs to be solved. And then discussions, to your point, that it's being widely discussed, but we did not do any deep dives specifically on who should own the topic or who should drive the topic.
And we made some steps forward last session, at least on some parts of 520 that dealt with licensure, but there's a lot more detailed work to do there.
Yeah. and I would say, important work, very
Right.
important work from what we heard.
Right.
So this was kind of the last slide, and then I mean I'm happy to go further into the appendix and discuss anything you would like to, but really, you know, and we titled this slide "Call to Action," right? And we ended the presentation to the commissioner and the board of directors with this, and it's called "Call to Action" because if you go back and think about the data we talked about originally, right? A third of the workforce can retire in 5 years. You're facing massive turnover. You're facing competition for jobs in areas you never faced them before, like in northern Georgia, where you are now dealing with some of the large manufacturing that's impacting not just, you know, your skilled nursing positions, but it's impacting your, you know, your hourly wage employees, right? Your food service, your janitorial. It's an unprecedented time. And I think it's also an opportunity now to really truly act. And if you don't act, those people are going to retire. You're going to continue to see turnover, and you're going to continue to see challenges. They're going to really start to crop up, even more so than what you're seeing now, right? We already are seeing beds that are unable to be filled, right? Just because you don't have the staff statewide, whether that be at a DBHDD facility or at a CSB. And so it's, you know, identifying those strategic partnerships with the health systems, with the community colleges, with the technical schools, with universities to start to drive and fill that pipeline, get those people in now is going to be ever important, because you have to groom and prepare for your next set of leaders. And so if you're, you know, a third of your workforce is going to retire, you have to be prepared to fill that pipeline back. You have to have a leader behind that leader, or you're going to be in a position where you're going to lose that institutional knowledge that you'll never get back. You need to have those governance structures and resources around automation and process, and how can we make things better and more efficient for our employees so that they can do their jobs better, more effectively, and care for more people that need it, and not spend their time, you know, buried in paperwork. And then, you know, ultimately a focus on kind of measuring and tracking those outcomes to make sure that the recommendations that are being taken action on are driving that ROI, right? Back to one of the commissioner's key goals was making sure that what we do at DBHDD does have a big, you know, our largest return on investment. And if you do that, then you're driving improved services, you're driving better patient outcomes. And at the very end, you're going to have a stronger and more resilient behavioral health workforce that's going to be able to drive your organization to the future. And that's really the ultimate goal at the end of the day.
Thank you. 22,
Believe.
21.
Thank you very much for explaining the report. And I have a few comments. First of all, it's great that there was an assessment done of the DBHDD workforce, but I think we need to be very clear that most of the workforce that was looked at was either administrative or those that worked in the state hospital. State hospital service is the only level of care that DBHDD actually offers. And so the data that you shared with being 19 to 25% below market impacts the entire provider community. And so representing a community service board, we've done really everything that we can do. We have relationships with our local institutions. We do lots of internships, education, mentoring, all those types of things. But no one is going to come to work when they have another option and accept a job that's 19 to 25% below market. And so the root of this comes down to support of the rate study that was done, both the behavioral health and intellectual and developmental disability rate study. And until we can pay employees a living wage, we're going to be floundering. And what it's doing is it's pushing individuals, instead of getting them the supports and services that they need at the lower level of the continuum, like outpatient services, it's pushing it to higher, more acuity level services like state hospital, where there's a wealth of other services that are available to support folks where they are, but the workforce isn't there to be able to provide those. And so I just felt it necessary to make that statement with regard to the entire provider network. And with the community service boards, you've made reference to CSBs a few times in your presentation, but they're the safety net providers. So for those individuals that are uninsured and Medicaid providers, CSBs are the front line. And we're struggling even more than DBHDD is as far as the workforce is concerned. So my suggestion is that we look at the whole provider network. We really need to look at it as a whole and the full continuum of care for individuals with behavioral health and intellectual and developmental disabilities. So thank you.
Yeah. And I think it's a great point. This study was specifically done for DBHDD. And so we didn't really dig into the CSBB data or CSB data, but I mean, I think your point is valid, right?
Yeah.
When you think about compensation, it's the same, a lot of the same job codes that we looked at here apply very much to CSBs as well.
Yeah, it really, I think, should encompass DBHDD and its provider network. And so that's the concern, is that if you're just focusing, and if all the focus is just on DBHDD, it's only on the highest level of care.
Mm-hmm.
Thank you.
I want to agree with you because I'm certainly hearing from my CSB about their vacancy rate in the clinical positions. And it's the clinical positions that are foremost in my mind. Our bed, the empty beds in our clinical empty offices are very much impacting services. So I know that the CSBs have some uniform way of looking at this issue. Mm-hmm. And I think it's a very strong point. We've got to consider the CSB issues, their vacancy rate and their clinical positions that they're most worried about. How much conversation did y'all have on the rate study in context of your workforce study?
The rate study was used when we were looking at in the compensation, when we were looking at the job codes and the compensation.
Mm-hmm. Yeah. You made reference to some challenges, even perhaps in North Georgia. There's a lot of warehouses and a lot of manufacturing being done in that area. And so you mentioned perhaps the food service employees and janitorial, but also the direct line workers, health service technicians. Mm-hmm. So there was another study, a bed study that was completed with regard to crisis beds. And at the behavioral health crisis centers, there is a real challenge with getting individuals to work as health service techs that are doing direct care for individuals, because they can go to a warehouse and make $5 to $10 an hour more.
It's a big issue. We know that, and we appreciate your work. And as I met with Commissioner Tanner about this, I was curious about the extent to which our overall administrative services folks or other leaders in state employment areas are already adopting some of these recommendations. It seems to be, of course, it affects every agency. I'm interested in how they're being implemented in other agencies or across state of Georgia. Have y'all looked at that? How many of your recommendations that there's already a pathway begun in Georgia somewhere?
So, I mean, as part of our environmental scan, we did look across the board, and I would say there were some recommendations that we pulled in, but the majority were not necessarily being implemented anywhere in the state.
Did y'all look at job share options?
I think so, but clarify just what you mean by the job share aspect.
I see occasionally an informal arrangement that employees have been approved to share a job. It gives flexibility. Flexibility seems to be the new word for a lot of our workforce issues, particularly for young families with long commutes. I'm curious whether those kinds of extending certain hour terms, job shares are really being looked at in a specific way.
Yeah, if you go to slide 9, we did have a recommendation kind of around that topic, which was around kind of reimagining flexible schedules,
Mhm.
to your point about thinking about, can you do things like part-time work and maybe they're not a full-time employee, but they're brought in another way and stuff like that. So that was one of our recommendations in the short term, were them to start to think about those more flexible type of work arrangements for their staff.
I certainly believe that's what people are asking for.
Yeah, no, they are definitely.
And also to find the talent. So I know among several of the CSBs, we do a type of job sharing for like IT services or billing services amongst the CSBs. So they may be an employee of one, but also do work at another one. So we're really extending our tentacles as far as we possibly can to try to get the workforce that we need, but it's still a struggle.
Thank you very much. I appreciate it.
Thank you.
I want to call forward now Elizabeth Holcomb, who has a new job. She's going to tell us about her new job, and Conte Calasani. Maybe they wanted to present together. I'll let them make a decision about that. And as they move forward, let me give you committee a little bit of a history of our efforts to legislate more formal process for data sharing among state agencies. We've had a bill that for 2 different sessions has bounced around and been discussed, starting with the Senate and Senator Tillery. And this year we came forward also as part of 520, and the Senate took a portion of the data sharing legislation and put it on another bill that actually got passed, and then the governor vetoed it. So we have had a little bit of a torturous path on this legislative issue, but the governor did what he said he was going to do, and he vetoed the legislation and entered an executive order. And the folks I talked to feel like the executive order did a better job than our legislative draft. So maybe it was ultimately a good plan. Elizabeth, would you like to start to talk about how this executive order happened and what it brings forward in terms of your work? And then I'll let you and Dr. Casalani make a decision about how you want to proceed. Thank you very much. Identify yourself and your new job.
Thank you, Madam Chair. My name is Elizabeth Holcomb. I'm the Director of the Office of Health Strategy and Coordination. We are an arm of the Governor's Office that was formed in legislation a couple of years ago. I joined the office a little over 2 years ago as their legal counsel when Grant Thomas was appointed by the governor to be director of the office. One of the first projects that was placed on my desk was data sharing, especially in the healthcare space. With federal and state laws that must, be considered in any kind of data sharing request. And we have so many different health agencies. So that's good to have specialized health agencies, but then you have those silos. So each one is a separate entity for data sharing. So it's nice to be here in front of the subcommittee. Again, I presented last year on my research on data sharing. So I'm glad to be here today just to introduce Conte Calasani, the director of the Georgia Data Analytics Center. And like Chairman Oliver said, the governor issued an executive order September 1st of this year that is a huge step towards standardizing the process by which agencies share data with one another across state government and recognizing GDAC as a facilitator in that process. So I'm going to hand it over to Conte to tell you more about this effort and the implementation of that. Thank you.
Thank you.
Thank you, Elizabeth. Good morning. Thank you for all the work you do. And I thank Elizabeth very much to help me go through this executive order and interpret what GDAC is supposed to be doing. So the way we learned is We are to develop templates for data sharing request and data sharing agreement, and socialize these templates with executive state agencies. Should an agency A require data from another agency, they can approach GDAC to help them speed up their data sharing process. But the initiation of the request and the data sharing agreement has to come from state agency. Elizabeth and I are working on getting these data templates together. We have data sharing request template and data sharing agreement initial drafts ready. We have given it to GDAC Data Governance Committee to review. Elizabeth and I will continue to review with this GDAC Data Governance Committee first.
Tell me who is on your data sharing committee. Is that something that is established prior to this executive order?
Yes, so I started with GDAC in December of 2020.
Mhm.
And in August timeframe, we had a couple of meetings in between, but in November 2021, we formally formed a data governance committee for GDAC. At the time, as the agencies started partnering with GDAC, we would bring an executive stakeholder, the business stakeholder basically, and an IT technology stakeholder. They would be part of the data governance steering committee. Under that bigger umbrella, there are different subcommittees, each have their own track. For example, data submissions has their own track of work that they do. Data literacy and analytics folks define data definitions. They help us understand. GDAC has to develop the domain knowledge. And these committee members, so we have data stewards, business stewards, technical stewards, which help with secure data transfer and submissions, understanding these data sets and understanding their analytic needs. But it's supervised by the data governance committee, making up of chief information officers and business leaders who hold different positions within the state. With this executive order, we have decided to add another track, which will be legal members from every agency, because it's very important for the data sharing agreement to be reviewed by every agency. So we are extending our governance committee to add that additional track.
Elizabeth, the research you did on what other states had done had been very helpful in terms of telling us that a uniform data sharing agreement is really essential, not letting every agency draft or every participant draft its own. And you are on track for that uniform data sharing agreement. When do you think that will be implemented? Either of you answer that question.
Okay, so Elizabeth has drafted, she's working closely with governor's office, and we have a data sharing agreement draft ready.
Mm-hmm.
Our goal is to give it to the data governance committee first. We have a meeting scheduled on November 9th with all the executive agencies, and we will give that draft out on November 10th, and they'll have till December 8th for feedback and comments, and we'll do revision rest of the December, and we hope to publish them or socialize them in January of 2024.
Good, thank you.
Thank you.
Other aspects of the executive order talk about a decision-making tiebreaker type. Would you talk to us about that some? Who's going to make a decision when the two agencies are in conflict about what data to share?
The executive order clearly has it in writing that GDAC is to assist them in helping understand the data sharing and the process. If there are conflicts, we will be escalating it to governor's office for their support in resolving the conflicts.
You may be aware that there was a lot of discussion about who should be the tiebreaker when their agencies have different, and I'm happy with the way this order is set out. But the only thing that's missing and I don't think it's critical missing, but I want you to comment on it. We don't have deadlines in their timelines. One of the complaints that I've heard is that agencies just kind of sit in a standoff and too much time goes by without a resolution. How's the governor's office, when the person in the governor's office has to make an ultimate decision on possible conflict, when is that going to happen? How are we going to know what the timeline for that is? And either of you can answer that.
I think those logistics are yet to be worked out. And when we have the legal team in place, we will establish a timeline on track. And Elizabeth, comment if you have.
Yeah, I was just going to confirm the executive order does not specify a timeframe. And I think it is that once we encounter these disputes and go through that process, it makes sense to maybe we can define those later on down the line. But again, it's just recognizing the tiebreaker that we were missing that process. So.
Thank you. And I think we have two projects that we have that have approached GDAC that we are planning to put this process through, and we'll learn more as we take these two projects through it.
When you say two projects, you mean two requests for data that has not been resolved yet, and that y'all are going to use those examples as a way to think through the steps?
So Department of Human Services is working on a larger project, which is also part of the behavioral mental health parity bill, HB 1013. So I'm working closely with the leaders on the Department of Human Services side. Once we have these templates, we plan to give it to them, and then we will work with those 7 agencies and see how this template works for them or not. And then a couple of weeks back, we had a DHS aging services and DPH researchers meet with GDAC along with dementia project team. So they have a data request for Alzheimer's population. So we will take these two projects through this executive order process, and we'll learn more from there, and we'll be happy to share.
Sounds like a good idea.
Thank you.
Appreciate the governor moving forward on this, and the two of you seem to be at the center of making this happen. So we look forward to progress.
I'm very thankful to Governor's Office, your subcommittee and committee, and Elizabeth for your help and support for GDAC.
Any questions?
That I've pointed out. That's 23. We're good. So one thing I pointed out before on the executive order is that it's the way their agencies are defined, the state agencies, that excludes some, for example, exclude state universities. And as we keep hearing about staff shortage, I would think that you'll have staff shortage also on analytics. So I think that this will help up to a point, but the fact that agencies will be able to, I think it's what to do with that data. And then you will share the data. This is great. It's a great step. But I think in 2 years from now, quickly we realize that, oh, we're going to have some reports and nothing really that will be will bring decision making. So I would hope down the road this will be expanded, so you'll have access to analytics outside of the state agencies, such as all our universities have great analytic programs that you could take advantage of and really enhance the work you're doing right now.
Thank you for that comment. I think, yes, the executive order clearly states that we are to help executive state agencies. There is a long list of agencies, but this order is restricted to state agencies only, and not Board of Regents, not the constitutional agencies at this time. And I hear your point. But I'm glad something got started. Being in the data environment with state agencies for over 2 decades, I'm pleased and happy to see the progress that we made so far. What we learn in next 2 years probably will advance us further.
I'd like to follow up with a question. I'm interpreting your comments that if Georgia Tech asks for particular data it does not fall within this particular executive order. Is that correct?
No, because if Georgia Tech wants data from, let's say, DHS,
Mhm.
they would need to work directly with DHS, but DHS can choose to use the templates that this executive order puts. If there's a conflict, then we are not authorized to be.
And Georgia Tech would be interested in data because they have a contract to provide particular services or because they're doing research. Is that sort of the two big areas where?
Correct, yes.
And I had always thought, and this, y'all correct me because you're more expert on this, that particularly in the child welfare area, that research-based requests were not barred by issues of confidentiality.
I think my knowledge is, I don't want to speak incorrectly, so I'm going to just speak to what I know.
Mhm.
Is if an agency aligns with Georgia Tech, for example, All Pairs Claim Database, DCH was working with Georgia Technology Research,
Right.
and they agreed to work with them. And GDAC is partnering with GTRI and OHSC. All Pair Claims Data project is going well. So I see the value add of the research groups coming and supporting state agencies. My knowledge of how we came where we are today is limited, so I'm just going to leave it to the experts.
Well, I just think this is something we'll be watching, and you'll help us watch that.
Yeah, absolutely, yes.
Thank you, ladies, very much.
Thank
We look
you.
forward to maybe sometime during the session, you can tell us how the implementation is going and what are the strengths and perhaps one other thing we might need to do. So thank you for coming today, and thank you. I know both of you are involved in drafting this order, and I think it represents real progress. Thank you very much.
Thank you.
Any other
Appreciate-
questions for these two ladies?
Thank you for having us here.
Thank you. I'm very happy we had this opportunity to have this public discussion. I assume, I kind of anticipate that there's going to be a lot of work done between now and December 6th. I anticipate that we as a subcommittee might meet by Zoom or by virtual in some way to talk through our recommendations. We have a lot of balls in the air, and I'm happy that we're able to report this morning on some progress we're making. Workforce gaps are our biggest challenges across the state. We know that, and we know that has to be a real focus of our mental health leadership reform. Anything else you'd like to say this morning? Thank you for coming. Either one of you?
A workforce study, just like we did for DBHDD, a deep dive into the workforce to understand the shortage, the compensation, accounting for the cost of living, and matching with the need for care. I think would be really helpful to see that coming through.
I think you're absolutely right. We also need to look at our rate study and implement it for some of these key positions and see what progress that brings us. Thank you, ladies, very much. We'll adjourn at this time and come back for more work in the future.